Great. Good day. My name is Laura Dillon. I'm a staff scientist at the National Heart, Lung, and Blood Institute. Prior to my time at NIH, I also served as a program manager and helped with managing grant review for the congressionally directed medical research programs. And so I'm going to use a lot of my experience as well as knowledge to provide you some guidance on how to write a successful grant. Before I start, here are my disclaimers. So first, I just have to say that any views expressed here represent personal opinion and do not necessarily reflect that of the National Institutes of Health, the U.S. Department of Health and Human Services, or the U.S. federal government. I also want to emphasize that this talk is geared towards early career investigators in the United States, but also has useful information for all career levels and geographic locations. So here's an outline of what I'll talk about today. First, we'll start about how do you get started with writing and deciding to apply for a grant, then go into the meat of writing the grant, then the review process, revising and resubmitting your grant, and ending with some common mistakes that people make. So getting started. Here's just a general outline of what the grant process is. So first, you'll begin by planning to apply. This will take a lot of time to do research and figure out what you need to do to actually apply for a grant. Then you'll write the application, submit the grant, and then the grant will undergo a review process. Hopefully at that point, it will be awarded. However, oftentimes you might have to revise and resubmit your grant. And then after it is awarded, you'll have monitoring and reporting that are required for your grant. So where do you start? It's very overwhelming, especially for new investigators figuring out, one, how to find grants, but getting everything together to properly put together your grant. So the first thing that you need to do is identify funding sources. There are many different options for this. The largest source of funding comes from the government. There are many different organizations that you can get funding from. Most people are well aware of the National Institutes of Health, which is the largest funder of biomedical research in the United States. You can go to this website here to get more information on different grants from the NIH. But many other organizations within the government also provide funding, including the Department of Defense, specifically the congressionally directed medical research programs. Link is here. And then you can actually look at all government funding opportunities at grants.gov. Aside from the government, there are many other sources of funding that you should consider. First would be professional societies, nonprofit organizations, but also don't forget to look for grants within your institution as well as with industry or nonprofit organization. So once you've identified places where you could actually get funding, you then need to do more work to look within those organizations to identify funding offices or programs within the larger organization. So I'm going to discuss two major government funding organizations to give you a little bit of an idea. So the National Institutes of Health is just that. It's many institutes. It's comprised of 27 different institutes and centers, as well as the Office of the Director. So your grant funding and funding opportunities and awards can actually come from different institutes or from the Office of the Scientific Director. So there are many different places you could identify, and it's a bit overwhelming to figure out where funding can come from. There's actually a matchmaker tool that you can utilize to find the right fit. So I recommend going and using this when you're trying to figure out the right home for your grant. In contrast, the Congressionally Directed Medical Research Programs, or CDMRP, are a portfolio of programs. So they have different goals that these programs have, and they actually receive yearly appropriations from Congress. So this can change from year to year, but you can do your research on the different programs that are available through CDMRP at this link. And so, your goal is to just really figure out the different types of organizations within the larger organization that could give you grant funding. So once you've done that, within those organizations, you can also have different funding categories or funding types. So this can vary from organization to organization, but I'll kind of go over the NIH since this has a very complex funding system. You can go to these links to look at different funding categories or activity codes to really understand the different types, but I'm listing the overarching different funding categories for the NIH here. Most people will be aware of the grants here on the left. These are the ones that you're most familiar with, and they're kind of broken down into two major groups. research training and career development. These are broken down by your level of training. So there could be individual fellowships. These are on the F series grants. There's individual career development. So this is more for when you're transitioning to becoming an independent investigator. These are the K series grants. And then there can be institutional training grants. So these you can apply for your institute to have training for individuals within your institute. And so I'm highlighting the K series here because many of our young early investigators will be looking into this. And then everyone is, of course, very familiar with the research and development, the R series grants. These are your larger and as you're starting to get more established as an investigator. But I also want to point out, people mainly think about these grants here on the left side, but there are many other types of grants that you should explore and figure out how they might be able to provide you additional funding outside of, what we traditionally think of in the K series and R series grants. These include construction and modernization, small business, loan repayment programs, contracts, other transactions, and challenges and prizes. So you can go to this link and read more about each of these different types of grants and figure out, if they could fit within your goals. So once you have the funding categories, then you will look for the individual funding opportunities. So these are the actual grants that you're applying to, and they will roll out throughout the year. So the first thing you need to do is review available funding opportunities, and you can actually subscribe for alerts on new opportunities. This will really help you plan well ahead because okay, this new thing is coming out, it's constantly rolling out. I'm including links here for subscribing to funding opportunity alerts from the NIH here and CDMRP here. It's also really helpful to read past funding opportunities as you're starting to plan to apply. You can get an idea of the types of opportunities that have been released in the past, and this can help you kind of create a roadmap in your mind of the types of opportunities to look for when they become available again. And this will also help you map out the general grant cycle of various organizations. So you can see, okay, this organization releases grants 4 times a year, and it typically starts at this time or only once a year. So you really need to start planning well ahead. So if you have an understanding of what the grant cycle is for that organization, you can start getting your preliminary data or working groups together. I also highly recommend attending webinars from the actual organizations you're interested in applying to, so you can learn exactly what the process is like for each one of these organizations, because it will be different from everywhere you go. So I'm giving 2 examples here. Here there's a nice yearly NIH provides a grants primer, process primer application to award, but they actually have these webinars recorded, so you can watch them at any time of the year. But if you register live, you could ask specific questions. CDMRP also has links to a series of webinars here. So any organization you're looking at, just dig into them and see if you can find webinars to familiarize yourself before you get started. I also highly recommend reviewing funded grants from those organizations, as well as other literature provided by the funding organization. Here, I'm listing a link to NIH Reporter that here you can click and explore individual grants that have been funded by NIH. But I also recommend looking at literature that's been released by the funding organization, such as annual reports, because this will really highlight the types of research that each one of these organizations has funded in the past, and will give you an idea of what their priorities are, and you can compare them to what your priorities are to find the right fit and help you plan out your grant. Okay, so now that you've done all of that research, it's time to actually write the grant. So the first thing you want to do before you do anything is check the eligibility section of your grant. The last thing you want to do is spend a lot of time applying for a grant and then learn that you don't actually meet the eligibility requirements. It's important to remember that there are eligibility requirements for both the investigator and the applicant organization. So you need to explore all of those beforehand, and some of it can be very overwhelming. So definitely reach out to the program director or officer listed on the grant to confirm your eligibility before you do anything. Here I'm just listing an example for NIH. You can find this in section 7. So do that the first thing before you invest too much time. I just wanted to briefly touch on foreign eligibility, because this is something that you need to consider And this eligibility can vary from organization to organization and grant to grant. So you need to pay attention specifically to that. And it can also apply to both the applicant organization and to the investigator. So you need to check all of those things. Just giving some examples with NIH, some awards do not allow foreign institutes or components. And also, for example, small business and some fellowship and training grants require U.S. citizenship or permanent resident status. So make sure you check those eligibility before you apply for the grant and talk to the grant organizations. They might be able to help steer you to better grant options if you find out that you're not eligible for some reason. Okay, so here's just some tips specifically for early career investigators. It's important to note that many organizations have grants or initiatives geared directly towards early career investigators. And so this is something that you should take advantage of if you're in that stage of your career. For example, NIH early stage investigators, this is someone who's completed their terminal research degree or end of postgraduate clinical training, whichever is latter, within the past 2 years, and has not previously competed successfully as a PI for a substantial NIH independent research award. You can follow this link to read more about what are the requirements for being an early stage investigator with the NIH and how you can, what types of opportunities are available for you. It's important to keep this in mind because priority is given for funding early stage investigators, and there are also specific award mechanisms that exist within NIH for this. And really click on this link and pay attention to the types of grants that you can have that allow you to maintain your ASI status, and you should be strategic when you're planning your grant application. Making sure that you're utilizing your early stage investigator status at the right time to maximize your grant potential. So next, once you've confirmed your eligibility, you have to get registered. And so this should be one of the first things that you do. So you need to review who and what needs to be registered and where. This can apply to both organizations and individuals. And registration in multiple systems might also be required. So you should really start early because it can take weeks to get registered, especially when multiple entities need to get registered. And you need to be aware of both external and internal deadlines for performing these registrations. You don't want to go through all the work of writing your grant and then find out that you don't have time to get everything registered in the system properly to get your grant actually submitted. So where do you get started? First, review the application guide and download all of the forms. I'm just showing here a link to all of the different application guides that are available through NIH, but you should do this at any organization and really review it in detail and look at all of the forms to make sure you don't have any questions. Next, you should establish your team. So you want to ensure that you include individuals with the expertise and experience necessary for performing the proposed research. Also, if you're not an expert in the field, be sure that you bring in collaborators that are. And you might also want to consider your funding organization's priorities before and bring in collaborators as needed. For example, if you're applying for funding through the Department of Defense and they list a priority is healthcare for veterans, you might want to bring in a collaborator who works with veterans or works at a military organization or something like that, so that you can align your goals with the funding organization's goals. Next, you want to determine the necessary resources that you need to actually complete the work. And if you don't have all of the resources necessary, again, bring in collaborators if needed. You'll also want to draft and revise the application materials with the project team, so allow plenty of time for that. And as always, reach out to grant staff if you have any questions. They're there to help you and they want you to be successful. Okay, so now I'm going to go into a series of actual grant writing tips to help you as you're going along your path. So first, you want to make sure that the specific aims that you lay out are clear and achievable. So you want to ensure that your hypothesis is clearly stated and that your specific aims clearly address this hypothesis. The goals must also be realistically achievable within the project period and the proposed budget. This is one of the things that people get a little bit overly ambitious. So you want to be very clear and realistic. You also want to tailor your specific aims to the grant. So don't just recycle aims between grant applications. The reviewers can tell if you do that. So you need to read and reread the funding announcement when outlining the project, and find ways to achieve your goals in a way that aligns with the goals outlined by the funding organization and or the specific grant. This will be really helpful in moving your application into a higher scoring position. Remember that you need to write the grant for the reviewer, and that the reviewer oftentimes are likely not experts in your exact subject. So you need to provide sufficient background and emphasize the significance of the project to the reviewer. Also, utilize diagrams and figures to simplify understanding of key components. This can really make it easier for the reviewer because they're reviewing many applications, and you want to make it as easy as possible for them to understand what you're doing and why it's important. And another way you can do that is by being clear and concise. So use direct and clear language. Make sentences as short and concise as possible. Avoid abbreviations and jargon, again, because your reviewer might not be an expert in your exact field. And consistency is key. You want to be clear throughout the grant. Don't change how you're referring to something or the way that you write. You want to have it to be as consistent as possible so it's as easy for the reviewer to look at as possible. Also, attention to detail is extremely important. This includes consistent formatting, clear labels, professional figures, and not only makes it easier for the reviewer to read, but it also provides confidence that similar attention will be placed on the research when it's actually performed. And to do this, get peers and collaborators and mentors to proofread and provide feedback. As you're writing, you're very immersed and it makes sense to you, and you might miss a typo here or there. Having other people who are a little bit more removed from it to read it will really help catch any of those little things that might take your grant to the next level. Also, can't emphasize this enough, ensure you follow formatting guidelines and page limits. You don't want your grant to be rejected because you used the wrong font or too many pages or something like that. It's also important to provide very strong preliminary data, and this is on multiple fronts. You want data supporting the study hypothesis. You also want data demonstrating your ability to actually perform those proposed studies. So be sure you don't underestimate the importance of illustrating capabilities down to the smallest level. You want to make sure the reviewer knows that you are able to complete this project. Also, be sure to justify the significance of your research. So you want to provide a clear justification of why your research is vital and why it's the logical next step in the field. So lay out a roadmap of how the research you perform will make a significant impact in the field. Next, you want to demonstrate innovation. And so you want to illustrate how your research will innovate the field, not only in its findings, but in the approach taken. You want to justify why you and your team are the ones to do it. So why you, why now, and why not somebody else? You want to justify what your team brings to the table and what makes you uniquely suited to answering this problem. Also, be sure you provide alternative approaches. You need to demonstrate that you've identified potential points of failure and what can still be learned in the event you need to employ your alternative approaches. You also need to demonstrate feasibility, especially in a clinical setting. So, for example, you want to run a clinical trial. You need to provide evidence of accrual, what efforts you're going to take to recruit, that you have support staff to help you with this. So you really want to prove to them that you're going to be able to perform this project. Also, make sure you justify your budget. And so you want to start early and clearly outline all expenses. And be sure that your requests are reasonable and in line with the field, because when they're comparing your application to somebody else's, they'll be like, this isn't, why, they're asking for too much money or not enough money, they're not being realistic or something like that. You also want to provide evidence of any additional support outside of the grant budget. So, for example, you want to do some extra study, but you have access to this core or something like that. You want to provide that evidence so they know that you have the support if you're not asking for support in your grant budget. You also be sure to work with your internal team and the sponsor to make sure this is all laid out properly. And also just think outside the box. Reviewers are looking at many applications at once. So you want to catch the reviewer's attention by demonstrating unique approaches to answering a problem, for assembling a team, or for disseminating the results. This will make you stand out compared to the rest of the field. And here are some tips specifically for early career investigators. So for example, for training grants and other early career investigators, be sure that you demonstrate mentorship. This is a big component of those types of grants. So you want to be very clear about who your mentors are and how they will how specifically they will mentor you. And make sure that you have mentors for different areas of growth. And aside from your mentors, you need to outline avenues, other avenues that you're going to take for career development, because they want to know that by supporting you early in your career, they're going to help you set up for a long and successful career. Another thing that's really important is just to read other grant applications. You can learn by seeing. So you could ask your peers to share their successful grant applications and peer review comments. Also, reading unsuccessful applications is just as helpful. You can really learn what reviewers are looking for and how these can be addressed to improve your grant. If you don't have anyone who could share applications with you, you can also utilize examples published by funding agencies themselves. So I'm giving a link here to sample applications and documents that are provided by the NIH that you can check out. So when it comes to actually submitting your grant, you want to make a calendar with both internal and external deadlines and do this from the beginning. You want to have your submission proofread by multiple individuals before you submit it to check for any typos or other things that you might be missing. And remember, don't be shy. You want to check in with internal staff and grant staff with any questions along the way. You don't want to wait to the last minute or be confused and fill something out incorrectly, and that will hold up your grant. And most importantly, you need to submit early. And by early, I mean as in days, not hours. You need to allow time for correcting errors and other technical difficulties. You don't want to go through all of the effort of putting your application together, and then you have a technical difficulty with actually submitting it within the system, and then your grant never even makes it to the table. Okay, so next, I'm just going to go into the review process a little bit and what to think about and how this will help you understand when writing your grant. So before it ever goes out for peer review, most grants undergo review by internal staff to ensure that all requirements are met. So make sure you pay careful attention to all grant requirements and guidelines. This will ensure that your application doesn't get rejected before it even gets reviewed. So next is peer review. So most organizations utilize scientific peer review committees for grant review. And it's important to remember that every organization is different. So you should read the specifics for each grant and review this before you write the grant, because the reviewers are your audience. And so you want to make sure that you understand who's reviewing your application and how when you're writing your application. I'm listing some links here to both the NIH and CDMRP describing their review process. I'd like to note that also many large organizations, including those like NIH or CDMRP, use a two-tiered review process. And so they're evaluating your application both on scientific as well as programmatic merit. So you need to keep this in mind. You could have a very scientifically sound application, but it also needs to meet the goals of the program. So typically, a grant is first reviewed by multiple reviewers within a study section before the study section meets, who provide scores and a written summary of strengths and weaknesses. And because of this, it's important to remember that not all applications are discussed in the study section. The top scoring applications from this initial review by a few reviewers are the only ones that are actually discussed in a full study section. If it is discussed in a full study section, additional comments are recorded within the study section, and all members provide scores anonymously. So it's important to remember that you need to get it past this first level. So making it really understandable to the reviewers, like I mentioned before, will increase your chances of getting it to review by the whole study application. It's also important, and I think I've seen this a lot, where you need to remember that your application will be reviewed by both scientists and non-scientists. In some organizations, for example, patient advocates can play a very important role in peer review. This was true at CDMRP. So you need to ensure that your application is understandable by individuals of all backgrounds, to make sure that really the impact is understood by everyone who's reviewing your grant. For the final funding decisions at large institutions, these final decisions often come from a representative of the organization. For example, NIH has come from the IC director or something like that. And it's both based on multiple factors. So this can include the peer review score, which we just discussed, but there's also many other things like does it meet the mission or program priorities or even available funds. So you could have a really great peer review score, but if it doesn't align with the other needs or available funds within the organization, you might not get funded for one of those reasons. Your final summary statements are provided, and this is a valuable resource, not only for if you have to resubmit your grant, but as you apply for additional grants. And so it's just really important to remember that you go into the grant review process with realistic expectations. We all want to obtain funding for our grants, but obtaining funding the first time, you have to remember, is highly unlikely. So it's a iterative process, and just go into it with realistic expectations, and this will help you as you navigate the process. So that brings us to revising and resubmitting grants, which is something that you most likely will have to do. So say, for example, your grant wasn't funded the first time, what do you do? The first thing you should do is talk to your program officer. Your program officer has a lot of insights, not only to, beyond what was written in the summary statement. They were in the room when your grant was reviewed. They understand the goals of the particular grant or organization. And so they could provide you additional advice and insight into, how you could improve your application, perhaps another funding mechanism that you might want to consider within their organization. And also in rare circumstances, decisions can be appealed. And so talking to them directly can help. Don't count on your decision being appealed, but you won't know unless you ask. So that's the most important thing, is to follow up with your program officer, and with them and with others, review the summary statements. And so you want to talk to your grant official, but also other mentors who have experience with interpreting and figuring out the next steps based on the comments that you've received from peer review. And so you want to utilize these comments to either redesign your proposal or potentially collect additional data, or to find a better funding mechanism, et cetera. So this is really a time to kind of reflect and figure out how you can improve your application for next time. And remember, it takes a village, so you should utilize as many resources as you can to increase your chances of a successful resubmission. And the more times you do this and the more you learn, it will become, you'll start to learn what is needed to increase your chances of getting funded. Here are some tips, especially for early career investigators. So one thing I recommend is actually watching a mock peer review study section. There are recordings, for example, available through NIH where you can see, what actually happens in the room. But, the best way to know what happens in the room is to actually be in the room. So I recommend participating in peer review. So many organizations have opportunities for early career investigators to participate in peer review. And I'm giving a link here. NIH actually has an early career reviewer program. So you could go to this link and actually become a reviewer. And this will help you figure out, really what is being expected as a part of peer review. Aside from that, you can read blogs, listen to podcasts, or subscribe to newsletters. I've provided some links here at NIH of some resources that you can really look into. And finally, I think working in a group always helps. So look for grant writing workshops or groups within your institute or through other societies where you can work with people who are also in the process of writing grants, and you guys can share documents with each other or learn from each other. It's really one of the best ways to learn is through a group. So I'm going to end with some common mistakes. So things you should just really keep in mind as you're getting started with writing grants. So one thing is common mistake is not reading the funding announcement properly. So if you don't follow the guidelines, your application will be withdrawn before it even makes it to the table. So make sure you take it. It's a lot of time and they're long, but it's worth your time to read it at the beginning to make sure that you actually are meeting the guidelines. Number one mistake a lot of people make, especially in the beginning, is not reaching out to the program official. Um, and be persistent. Remember that people are busy. And so don't take the absence of a response from your program official as disinterest. Keep trying. So just email them again or do what you can to try and reach out to your program official. They do want to help you. Another thing is not considering the priorities of the funding organization. So if you in your grant you focus on areas that are not clearly outlined as a priority, you have a low chance of getting funded. So they spend a lot of time setting up these priorities and writing these funding announcements. And so they're not just there for fun. You should read them because they're literally giving you a roadmap of what they want to fund. And so make sure you are paying attention to that and picking grants or focus areas that align with the organization. Next is being overly ambitious. Many people think, oh, I'm just going to, say I'm going to do all of these things that they're going to fund me. But actually, that can work against you. This could be having too many aims or having an unrealistic timeline. So don't be overly ambitious. But at the same time, make sure it doesn't have a low impact. You don't want the research to be incremental or just descriptive. You want it to really move the field forward, but in a realistic manner. Another thing would be lack of vision. So this is a failure to present a strong hypothesis that's linking all the aims of the grant together. And while you want them to be linked together, you also want to avoid inter-aim dependency. This means that the results from one aim are required for the success of the other aims. So you want them to be connected, but also independent enough that if one aim fails, you can still continue with the grant and complete the other aims. Next is lack of expertise. So one thing is if you're not an expert in the field, I've mentioned this before, bring a collaborator who is, and avoid jumping from area to area, aka chasing grants, as this can be viewed as a lack of focus. So if you really want to work on that area, great, bring in a collaborator who helps you, but make sure you have some sort of connection and clear focus within that area. Also a lack of preliminary data. So it's very imperative to show feasibility of completing the project. Getting a grant is competitive and they want to make sure that if they invest in you, that they're going to get the results that you're promising. So if you don't have data suggesting this, this will limit your potential of being funded. Next is poor study design. So this could be a flawed approach or a lack of discussion regarding pitfalls or other alternative approaches. And finally, poor grantsmanship. This can be anything from grammar, typos, disorganization, clutter, complex graphs or figures. So you really want to make your grant look nice and read easily for the reviewer. So with that, I just want to wish you good luck and remember that you just have to keep trying. It's an iterative cycle. You try again, and eventually you will succeed. And so the more you work at it, the more you learn, and eventually you'll be successful. Thank you for your time.